What we're doing when we're scoping these horses is trying to evaluate their throat function. And the reason that that's important is because the more oxygen a horse gets when it's racing and performing, the better that it can perform. We look for several things. We look for structural abnormalities or functional abnormalities. And so basically, you've got two sides to the throat, and ideally they should function similarly. So we're grading the throat for symmetry, for one thing. And so when the horse breathes in, the arytenoids open up maximally, and they should be able to hold, and then the horse breathes out and the horse closes its throat down. So that's the left side of the throat there, and when we have abnormal function, it's 90% of the time it's on the left side of the throat. So those are the arytenoid cartilages that we're evaluating for symmetry and function, and then there's the epiglottis down below. And then you've got the epiglottis, which is at the bottom of the larynx and sticks forward, and the function of it is to cover the airway when the horse is eating. But you want to make sure that that's a normal, healthy epiglottis that isn't going to impair the throat function. Sometimes a horse will displace their epiglottis. The epiglottis can be entrapped by a piece of tissue sometimes. So these are all the things that we look for. They also can get sick. They can have inflammation in the throat. We call it pharyngitis. And then this is the roof of the pharynx, and those little tiny pimples, which are basically white and innocuous, are fine, but when those get bigger and inflamed, we call that pharyngitis. When you start putting all these horses together in one place, it's like kindergarten. They can get each other a little sick, and usually it's no big deal. All right, that is good for me. Essentially, it's one part of our assessment of the suitability of the horse for racing. So on the scale, there are certain throats, grade 1, grade 2 throats that are fully functional and normal throats. Sometimes you'll see a horse with some impaired function of one side of its throat, where it's not able to fully open or hold. And of course, that plays into our evaluation of the horse. Of course, in conjunction with that, we do a complete physical examination of the horse, make sure that the eyes are normal, listen to the heart, make sure that there's no heart murmurs or abnormalities of the cardiac rhythm, palpate the limbs. We're looking for things like whether the horse has got a set of shins from the work, whether they have a splint. Usually if they have one, it's quite old and not significant. Any filling in the joints, filling in the ankles, things like that. And again, not necessarily that that's going to preclude somebody from buying one of these horses, but it might go along with the x-ray findings, where if you see a little bit of ankle filling and a little bit of looking on the top of the first pastern bone, you'd say, well, this horse is probably going to be fine, but probably also could use a period of rest. Whereas other horses may not need to stop training, they just be able to be trained forward. So essentially that's what we're doing, and then of course we pair the physical examination and the exam of the throat with the review of the radiographs in the repository to see if there are any abnormalities in any of the joints, knees, ankles, hocks, stifles. And then we put all that information together. And then of course that conversation happens with the potential buyer, perhaps their trainer, their agent. So we have a full conversation to try to put everything that we found into perspective.